We need to stop speaking about this young woman as headline news and start focusing about her story as evidence. In Guyana, our public hospitals still operate with open wards. Patients separated by curtains, conversations overheard, diagnoses exposed. No real privacy, no real dignity, no meaningful protection for someone already in shock. And that matters for this conversation. When a young pregnant woman is admitted for observation after receiving devastating news, the environment becomes part of the treatment. Privacy is not a luxury, it is medical care. Psychological safety is not optional, it is clinical necessity. Yet somehow, while under observation, she was able to access a window and end her life. That is not individual failure. That is a system's failure. You see, observation without security is not observation. Curtains are not confidentiality, and a hospital that cannot physically protect a patient in crisis is not equipped to manage mental health emergencies. Now, let's say the uncomfortable part out loud that many of you will be upset about. We are fighting each other over cash grants while our healthcare infrastructure is outdated and unsafe. But quiet about private rooms, quiet about secured wards, quiet about suicide prevention protocols, quiet about trained crisis staff, quiet about spaces where bad news is delivered with support instead of exposure. You see, cash grant helps for today, but infrastructure save lives for tomorrow. You cannot claim to value life while ignoring the conditions that strip people of hope. You cannot talk about development while women receive life-altering diagnoses behind curtains. You cannot blame individuals when the system leaves the door open. And in this case, literally. This is not about politics. Nothing about what I'm talking about is about politics. It is about priorities. A nation's health is not measured by how much money it distributes, but measured by how safety is held. It's in its most vulnerable when they are breaking. If we truly want to honor her life, we stop speculating, we stop shaming, and we demand hospitals that protect the body and the mind. Because no one should ever walk through a hospital door for care and leave through the hospital windows. This is Athena with the Athena Show. Like, share, and comment for more difficult conversations.